How does obesity affect blood pressure through the sympathetic nervous system? Imagine your body's control center for involuntary actions, the sympathetic nervous system, acting like a busy traffic controller. When someone is obese, this traffic controller gets a bit more active, especially around the kidneys. This increased activity is a big reason why blood pressure tends to go up in people with excess weight. In obesity, especially when there is a lot of visceral fat, which is fat stored around internal organs, the sympathetic nervous system sends stronger signals to certain organs. The kidneys are a primary target. These signals tell the kidneys to hold onto more sodium and water. When the kidneys retain more fluid, the blood volume increases, which makes the pressure in your arteries rise. This is a major cause of high blood pressure in obese individuals. Even though the sympathetic nervous system also becomes more active in skeletal muscles, it doesn't necessarily cause the blood vessels there to tighten. Studies show that blood vessels in the limbs of obese people don't constrict more, despite higher nerve activity. So, the main effect on blood pressure comes from how the kidneys respond, not from widespread narrowing of blood vessels. The activation of the sympathetic nervous system in obesity is complex. Sometimes, the signals to the heart may be normal or even reduced because of reflex mechanisms. Also, the parasympathetic nervous system, which usually calms things down, is less active. This imbalance can lead to a faster heart rate, adding to the overall increase in blood pressure. Understanding this process helps us see why treatments that target the kidney's sympathetic nerves can be effective. Medications that block these signals, like certain adrenergic receptor blockers, or procedures that reduce nerve activity around the kidneys, can lower blood pressure in obese people. In simple terms, obesity causes the sympathetic nervous system to work harder on the kidneys, making them hold onto more salt and water. This extra fluid raises blood pressure and increases the risk of hypertension. Knowing this helps doctors choose better ways to treat high blood pressure in people with excess weight.